Does an apple a day really keep the doctor away? Research and Evaluation by Melanie, Katie, Danisha, Stephanie, and Tamara. The fourth area of responsibility is conduct evaluation and research related to health education. In this lesson, we will walk through the competencies of this area of responsibility. Research is an organized process. It involves a systematic progression through a series of necessary steps. The purpose of research is to conduct a thorough investigation in order to gain knowledge and understanding of a specific topic. Evaluation assesses a process or program to provide evidence and feedback for the program. The purpose of evaluation is to investigate the initial objectives were met and the information presented is being understood. Objectives: to gain a further knowledge of how to research and evaluate, to discover tools to assist in the research and evaluation process, to explore the importance of how research and evaluation relates to public health. Research and evaluation are important in a number of different settings. In the next few slides, we will explore what settings research and evaluation can be used in, and how they are used. On this first slide, you will see community settings. In school settings, health educators may be called upon to assist in the documentation of students' knowledge on health attitudes and behaviors. Research and evaluation is especially important in the school settings in the curriculum goals and objectives and learning activities. In the healthcare setting, health educators must be able to understand and interpret research findings for patients and for their families. In the business and industry settings, health educators must be able to help determine quality and cost effectiveness of competing health plans to benefit employers and employees. At the college and university settings, health educators are expected to engage in scholarly endeavors that include research, grant writing, and dissemination of research findings. The university health service settings are similar to those of the business and industry and healthcare settings. Skills in all facets of research include qualitative and quantitative research. (4.1) Develop evaluation research plan. Determine the reason for conducting the research. Create objectives, and create effective research and evaluation questions to guide the research. For example, if Sally heard from her cousin Adam that an apple a day keeps the doctor away, she wants to investigate if eating apples daily could improve her health. (4.2) Design instruments to collect evaluation and research data. Instruments are used for both quantitative and qualitative data collections. An example would be face-to-face, telephone, traditional mail, electronic platforms. Instruments are designed to answer questions that are being asked by the evaluator or researcher. This process can be time-consuming. (4.2) Continued. When preparing new data collection, it's important to keep in mind that the instruments are easy to understand. Use easy language and avoid technical terms. Be sensitive and keep it short. An example of this would be if Sally decides that she is going to create and send out a survey via email with a series of questions regarding current health status and eating habits to her coworkers in her office to get a general assessment to begin her research. Collect and analyze evaluation research data. Once data gathering instruments have been developed and reviewed, health education specialists carry out the evaluation or research plan. They analyze the findings, integrate the findings to reach a larger understanding. An example of this would be once Sally creates her survey online, she sends it out to her coworkers. She then gathers her results to look for any noticeable patterns. 4.4. Interpret results of the evaluation and research. Interpretation is the effort of figuring out what the findings mean. Health educators' ability to interpret results for their own and others' evaluation and research is essential. It's essential in decision making, policy development, and implementation of programs. Evidence must be interpreted to determine the practical significance. An example of this would be if in Sally's research she finds that those who typically eat an apple daily report less sick days than those who choose not to. 4.5. Apply findings from evaluation and research. Findings can be applied based on the intention of the user. Results from the research and evaluation can be in the form of a presentation or an overview. The applied findings can be used for recommendations for programs or policies. An example of this would be if Sally compiles her findings into a report and presents them to her coworkers at their next staff meeting. She suggests that the company makes healthier fruits more accessible in their workplace to help reduce the amount of sick days workers actually use. Now time for an activity.